the hearing industry has been trying to work with PCPs for a long time to try to get referrals. As you said, you did as well early on. So how are you at PHN able to connect the dots with this service model in a better, how did you crack that code?
It wasn't easy. Took a lot of work, a lot of effort and investment to work with enough PCP offices to understand the common denominators amongst them, and then be able to really build a model around that commonality to be able to grow the business. So, after several years of now working with PCPs, we've really developed what we believe is the model to be able to scale. And we're excited about that moving forward, that, we can now accelerate growth with more predictability.
Yeah. So talk about that model a little bit, that you've kind of come to figure out.
Well, I guess when it comes to connecting with PCPs in that context, the first thing was from a sales perspective, was it something that they wanted, as a profession? Did they want that service inside their office? And we learned very quickly that, they do care about patients' hearing. They just are challenged to be able to deliver that service, So we knew if we could develop a solution to that, we could be successful within the primary care space. Second was operationally, we needed to make sure that you could build a model that ensured predictability, it was profitable, and it could scale. And if so, then, it could be built. And then the last thing from a marketing standpoint was, could we increase patient flow? Were there marketing strategies that we could identify that increased patient flow? And then, of course, location growth. How, from a business development standpoint, how can you economically scale the business and remain sustainable and profitable?